So if we talk about preeclampsia, part of this also, Lena, is me making sure that you're aware of the signs and symptoms of preeclampsia. I know we're going through a lot of information, so don't worry. I'll be giving you some handouts today to take with you about aspirin use and about preeclampsia signs and symptoms and about what to look out for in the postpartum period. So when we talk about risk factors for preeclampsia and what you can look out for, it's really important that you trust your body. You know how you feel normally, and there are some classic symptoms that come up with preeclampsia that maybe would be very subtle, and you might think like, is this worrisome or not? And so that's why we want to talk about it today. So the first would be any vision changes, like loss of vision field, or feeling like there's a curtain coming down. Any sort of new onset vision changes would be something I'd want you to tell me about. Second, if you have a headache that doesn't respond to Tylenol, sleep, some basic measures, and a headache that is pretty severe, we would want you to let us know right away. A headache can symbolize that your blood pressure has changed rapidly or that there's some swelling, and we would really want to pay attention to those things. Third, we want to be paying attention to swelling that isn't just in our lower extremities, right? It's pretty normal for us to have swelling in our bilateral lower extremities, but I'm talking about swelling that is in your hands and arms, and particularly the face. So new onset worsening of swelling, like that would be something you'd want to bring up to me. And then finally, any abdominal pain that is particularly in the right upper quadrant or right here where we call the epigastric region and the stomach midline that potentially radiates to your back. Those would be another very concerning symptom that we would want you to come in for and or call the office about. It's also really important that if it's after hours or weekends and you're having these symptoms, that you go to our labor and delivery unit or an emergency department to be evaluated. Don't wait because it's nighttime or a weekend if you're having some of these symptoms. And finally, because you are at risk, at some point we may talk about giving you a prescription for a blood pressure cuff that you can have at home so that we can monitor your blood pressure and you can be empowered to know what your numbers should be, what's not normal. And if they're not normal on those blood pressure cuff readings at home, that you would be able to know I need to go in, even if I don't have symptoms.
Okay.
What are your thoughts hearing all of that?
Well, let me just review it with you, just
Sure.
so I know that I understand what you're saying.
Absolutely.
So if I have symptoms like I'm just not feeling like myself,
Yes.
I have changes in vision,
Yes.
I have a headache, epigastric pain,
Yes.
then I should call your office.
Yes.
Or if it's after hours, come to labor and delivery.
Correct.
Okay.
Or an emergency department if they don't have a labor and delivery where
Okay.
you are. That's perfect. And then we'll also likely be giving you a blood pressure cuff at some point to monitor your blood pressure at home.
Okay.
And we'll give you a book, or you can print out a piece of paper to take a log, and we'll have the normal measurements or the measurements on blood pressure that would be worrisome that would warrant you to call or come in.
Okay.